So if you watched our video on the 3 elements of medical malpractice cases in court, then you know that the 3 elements are standard of care error, damage, and causation. I want to do a video today to talk about causation, proximate cause, or cause and effect. Different ways we can say these things. Again, just to summarize, we have to connect the medical error to the damage with causation. And we have to do it with scientific or medical evidence. And sometimes that can be challenging in a medical malpractice case, so I thought it might be educational to talk about 3 examples of cases that often have causation problems. These are examples of cases that I hear, these fact patterns, sometimes once a week. An email, I get a call, somebody sends me a package of records, and these fact patterns just repeat over and over again. And I usually can't take these kind of cases because it's a causation problem. So let me go through them one at a time. The first is this fact pattern. Imagine I receive a phone call. Hi, Mr. Stewart. I want to tell you about my son's case. My son fell off his horse. He fell off his horse and let's say he broke his femur, he broke his leg. But we didn't know that at the time. We just knew that his leg hurt really bad. So we took him to the ER in our local rural area, and they took x-rays and they looked at him and they said he was fine. They didn't see a break in his leg. His leg hurt like heck, but they didn't detect the fracture in his femur. And so they sent us home, and we were home for a couple of more days. His leg kept getting swollen and hurting and getting purple. And so we said, to heck with this, let's go to the next ER down the road. They did that. The x-ray was taken and they saw an obvious femur fracture. And then they had to have a surgery, and now their son is in a cast. And they call me and they say, Mark, we have number 1, meaning the standard of care was violated because clearly the radiologist must have missed the fracture on the first ER visit. And that sounds pretty logical. Maybe the radiologist did indeed miss it. It's very suspicious. It's worth a look, you'd think. However, and by the way, are there damages? The second element? Sure. The kid has a broken leg. But can we connect the broken leg to the failure of the radiologist to catch the fracture in the first ER visit? No. We don't have a cause and effect relationship. First of all, we know that the cause of the fracture was falling off the horse. Everybody agrees, even the parents of this son, know that it was the horse kicking the kid off the back of the horse that broke the leg. The doctor didn't break the leg. What the doctor caused was a delay in diagnosis of that fracture, right? It should have been diagnosed on day number 1. Instead, it was diagnosed on day number 3 after the fall. So the delay, are there any damages connected directly to that delay? Well, in most cases, no. Maybe the kid had a little extra pain for a couple of days, but he was going to have pain and recovery anyway. It didn't change the need for a surgery. It didn't change the need for a recovery time, a cast, and all that. All those medical expenses were going to be incurred even if they had diagnosed the fracture in that first ER visit. So there really aren't any damages that flow from that causally, because there's no causal connection. The horse broke the leg, not the radiologist, right? Okay. Second scenario. Mark, I went to the hospital because my chest really hurt, and I was short of breath and I was sweating and my arm was numb. Sounds like a heart attack to me, but that's not what they diagnosed. They said I was just having indigestion and they sent me home. When I went home, my chest kept hurting, and so I went to the next hospital, and their ER correctly diagnosed that I was having a big heart attack. Okay, well, sounds like a case, maybe. Well, maybe they did miss it. But that delay in diagnosis of that heart attack, we're usually not able to meet the burden of proof to show that the delay caused anything additional damage-wise to the patient. Now, had the patient passed away because the heart attack reoccurred and it was so horrible that it took their life before they could get to the next ER, okay, well now we have something manifestly different and new that happened because of the delay in diagnosis of the heart attack. But that myocardial infarction, if it didn't take their life and it just lingered, we usually can't connect any other damages to that. Connection means proximate cause. All right, the third scenario I thought I would talk about, and this can be a whole video all by itself, but it's cancer, the failure to timely diagnose cancer. Maybe the fact pattern that's commonly received by me goes like this. Mark, I had a cough and I couldn't get rid of it. It went on for months and months, and I saw my local family practitioner. And I saw him like 5 times over a few months, and he never took an x-ray or did anything. And eventually I was coughing up, spattering blood and things like that. So I went to an internal medicine doctor to get maybe a more thorough exam, and he did an x-ray, and I have lung cancer. And guess what? It's in stage 3. Maybe if my doctor would have caught it 4 months ago, it would have been in stage 1. All right, well, my experts tell me that delay in diagnosis of the cancer, and again, I think we all agree that the doctor didn't cause the lung cancer. The doctor just didn't timely diagnose it so that treatment could get started 4 months sooner, right? Well, that 4-month delay, did that change the patient's prognosis? Did it change the treatments that they may have to have? Did it change their survival rate? My experts, depending on the cancer, but particularly in lung cancer, they will say, no, that delay probably didn't change the patient's outcome. So the damages for my client's lawsuit are restricted to just what was caused by the 4-month delay. Not all the other cancer treatment. That was all going to be required anyway. Cancer just doesn't grow that fast with most forms of cancer, certainly not in lung cancer, over just 4 months for it to manifestly change the patient's outcome. So that's another example of a case where proximate cause or cause and effect or causation, that third element, that's where it usually makes us unable to take and successfully pursue a case. Well, I hope this has been informative. If you have any questions, feel free to email me. You'll see my email at the end of the video. Thanks.